Hey ladies, my name is Ree.
And I am T.
We are the Best Buds and we're back with you for another topic. And today's topic is going to be about the dreaded menopause. Oh my God, ladies. So we're going to talk about our experience. And remember, if you haven't gone through menopause yet, you know, everybody's experience is different. For me, my experience has been dreadful. I started menopause when I was 50. I'm now 57 and I'm still going through it.
Okay.
And I've had all of the symptoms. And just know, ladies, that there are over 24 symptoms that you may experience when you go through menopause. Hair loss, anxiety, fatigue, constipation, issues with your stomach, dry skin, vaginal dryness, so many different things, tender breasts, So I say that all to say is that, yes, I started when I was 50. My weight gain went like through the roof. And it was just absolutely terrible. I just was like, what is going on? I've always been somewhat of a small person. And so now, I struggle, I'm up and down because, I'm hot, nighttime, I'm hot, I got the fan on and the AC's on at night, and, I'm covered with the cover, then I take it off, then I put my foot out the bed. I mean, it's just so many little things. And, also you start to experience certain issues like high blood pressure, high cholesterol. Your body's just sort of changing. It's all over the place. It doesn't know what's going on.
Now I want to jump in.
Yeah.
So you mentioned high blood pressure can come with menopause.
Now, just to say, I'm not a doctor.
Right.
But all I'm saying is that when I went into menopause, when I turned 50, I had never taken a medication whatsoever. Just regular supplements like vitamin D or vitamin C, something like that. I'm telling you guys, I went to the doctor and then she was like, have you ever talked to anybody about blood pressure? I'm like, no, it's always been great. She said, don't get scared. And she told me my number. I was floored. I was like, well, what happened?
Yeah.
But then, as time went on, I just didn't understand what was going on. But when I started looking, and talking to holistic doctors, etc., they were like, sometimes your body fluctuates and stuff like that. And some women do start having elevated blood pressure readings. And so that's what happened to me. And so I have been on blood pressure medicine since, but yeah, everybody's different. I do know with me, I had headaches, I had migraines, low sex drive, all of those little things will come. But, everybody's different. You might sail right through, you know. But for me, every time I had an issue, I always felt like something was wrong.
Okay.
It's like your body don't feel right, you know what I mean?
Right.
And I was just like, what is the problem? I would go back and forth to the doctor. I swear I saw everybody, every specialist, and they're like, you're fine.
Right.
I'm like, what is going on? Why do I feel this? Or why do I feel that? Why does my muscles hurt all the time? Why does it feel like, I can barely walk sometimes? Why am I so tired? I'm fine. My blood work says I'm fine.
Right.
So, I chalked it up to, menopause.
Right.
I'm having a hot flash right now. Believe it or not. I'm hot.
I ain't mad, girl. So let me ask a question though. So, what can you do about, because you mentioned weight gain.
Yes.
And I know we're going to get to that in a minute. I had weight gain because I had what you call a partial hysterectomy, but we'll get to that.
Okay.
So, do you find it harder for you to
lose
the weight since you're going through menopause and you gain the weight?
Exactly. It's very hard. For me, it's been very hard. I've been on keto. I've been on Weight Watchers. I did low carb.
Okay.
I've ordered meals from Factor. I mean, I've tried so many different things. And so now now I'm at a point where, I'm just going to manage what I eat as far as portions, cut back on the sweets, and exercise, drink water, don't drink, a lot of alcohol and all of that stuff, and love meat.
Now, what do you find helps, what do you find, which is food, that helps you with the menopause? Is there any food that you can stay away from or add that will
Well, what I
help?
try to focus on is like blueberries, blackberries, things like that, nuts and seeds. Making sure I get plenty of fiber in my diet. Which I have a lot of issues with getting fiber in my diet because I have IBS as well. So I try to take Metamucil, things like that, or eat Raisin Bran sometimes. Just something that has some type of bulk. Eat oatmeal. You know, things like that. But for me, that's pretty much what I have found. I've tried so many supplements, ladies. I swear, I've done so much research on menopause. But can I just say, there are two lovely ladies that I follow, and I've been following for years. And I'm going to put their information in the description below. However, the first lady's name is Menopause Barbie. Make sure if you follow her and watch her videos, start from the very beginning. Don't skip around because you'll lose so much information from her. She's a retired OBGYN doctor, and she does see clients, but it's so hard to get in to see her. But anyway, she's excellent. You learn so much from her. And then also, I also follow Dr. Mary Clay Haver. She formulated the Galveston diet.
And what is that?
So she came up with a diet to help women going through menopause, to help them kind of, you know, help with their weight loss and things of that nature. She's a pro advocate for making sure you get your vitamin D, your omega-3s, your probiotics, you know, making sure you get the fiber in your diet. She also talks about taking magnesium, you know, so, you know, again, make sure you always consult with your doctor, but she is a board certified OBGYN doctor as well. She left her, regular job and started her own practice in Texas to help women with menopause. So I'll make sure that I put their information in the description below just in case you want to, you know, look it up. But, you know, like I said, I've done tons of research, tons. I have books and all kinds of stuff. And it's definitely something that, you know, is going to come for all of us. Some women may fly right through it, but I can say for me, my experience, has been terrible.
And every woman's experience is different because my mom was sharing with me some stories that women even have mental breakdowns, lose their minds really on when they go through menopause. So you don't know what you're going to experience. Do a lot of research. And if you are in your 40s, 50s, like I said, I started getting hot flashes in my 40s, and you feel a certain type of way, go to your doctor because you could be going through menopause, but every woman's experience is different. We might have some of the same symptoms, but some can be more severe than others. I know when I started my menopause, I started with wetting the bed, and not the wetting the bed that you would think of like I'm urinating on myself, of course, but it was like somebody poured a bucket of water on me, literally. And I would look over at my husband; he's dry as a whistle, and I'm like, I know I don't pee in the bed, so what's going on? So after a couple of weeks, I just started noticing that I'm in my 40s. This definitely could be menopause, right? And I was premenopausal, but you call it perimenopause. She said it's the same thing, but the medical term is perimenopause. So I dealt with that for over a year, I think it was. And then it kind of tapered off as far as the being drenched, right? But then I start getting the hot flashes, just sitting in my car driving, and when it comes on, it comes on. I remember I was in a supermarket one day and the lady, looks like maybe she was a little older than me. And she had to stop ringing me up and told me, could I hold on for a minute? And she literally went to the ice cooler, opened up that door and put her head in there for a couple of minutes. I didn't know it could get that serious, but as the years went by, sometimes you have to stick your head in the ice box. It could be, sometimes it's almost embarrassing. So you have to love on yourself to know, you know what? This is a thing that you just gonna have to go through.
That is true.
And most women, if you're around, they understand. They understand, especially if they're, in your age. Even if they're not, they could be younger. Their mom, grandmother, somebody could have went through it. So most people, do understand.
Yeah, they do. And Tammy, one of the things is that I've tried many hormone replacements. I have. I've tried the patch. I've tried the gel. I've tried the cream. I've tried the bioidentical hormones. And I'm very sensitive. And so I just never could take to too well to it. So like, you know, I still have my uterus, so I have to take progesterone, you know, so I don't do well with the progesterone, you know, so I mean, I have tried, you know, and so sometimes, you know, some of us, we just have to suffer through it.
Right.
And believe it or not, just so you know, you have 10 years, ladies, once you begin menopause, not perimenopause, menopause, from what they say, to try to get on something before it's sort of like, you know, your doctor may say, you know, it may be a little bit of a concern. But there are some doctors out there, like Dr. Mary Carrier, and I'm not, don't quote me, but I believe that she said that, you know, it's not really 10 years, but so, you know, everybody's a little different.
So let me stop you right there.
Yeah.
So you said we have 10 years from the time we start menopause to try to get on some type of supplement?
Some type of hormone replacement therapy.
Really?
But,
okay.
But like I said, everybody believes something different. Now, Menopause Barbie says 10 years.
Okay.
Mary Claire Haver is a little different, but you know, they're both excellent. Please follow them because they're really good. But yeah, so you know, I did try again with the bioidentical.
And what is that?
So what it is like it tailors to your body.
Okay.
And they also have the pellets. I will never do a pellet because first of all, it's too expensive.
Okay.
And I'm so sensitive. If they put it in me, I can't get it out. You can't take it out for like 3 months or so. Yeah, it's like it's a piece of rice.
Really?
Yeah.
And what is that supposed to do?
It's another form of a hormone.
Okay.
For you. And you know, a lot of doctors that not a primary care doctor, you have to go to a certain doctor to get this pellet, and it's very expensive.
Expensive and how much?
Can be like $700.
If for one
every
pellet?
3 months.
Wow. That is kind of expensive.
Yeah, you know. And so, and now, for anybody out there that's going to come at me and say, you know, I love my pellets and, you know, and I didn't pay $700 and you can do it more than 3 months. I don't know all the specifics, so please forgive me. But from what I do know, because I've had a consultation for pellets, and this doctor was going to charge me $700, and the pellet was going to last for 3 months. They insert it in your buttocks area. They make a little incision and they put it in there. And so it's supposed to be in there for like 3 months, and then it's supposed to give you the hormones that you need. But the bioidentical cream that I have, you can rub it on your inner arm, your thigh, your stomach. Some doctors want you to put it on your labia, you know, and so, you know, there's so many different methods out there. You know, you just got to find what works best for you.
You can get your man to put it on your labia if you want to, or your buttocks.
Well, yeah, but please use gloves though, because he's not supposed to touch the cream. Oh, okay. Yeah, because you don't want anybody to touch the
glove will be fine.
Yeah.
The glove will be fine. Okay.
But you did talk about your hysterectomy.
Yes.
Let's talk about that a little bit more.
Okay, so I had fibroids, and I knew I had fibroids since I was in my early 30s, maybe late 20s. And when I found out I had it, the doctor said it was like a little pea size. So it wasn't of any concern. So he said, if it don't bother you, you don't bother it. Never had any experiences with cramps or anything. Not until 2014. My husband was in the military and our duty time was up, and we were making the transition back home, and home is in California. So they have a lot of foods at home, which is California, that I wasn't privy to in either Miami or Memphis or wherever I was before coming home. Not that they didn't have the foods, it just wasn't hitting like home. So I really wasn't interested. And I was on my health game in Florida, you know, Memphis. I was really seriously into fitness. But when I got home, I was too. However, I was so excited to be home that I just went off, you know, got me the fried fish, fried me some shrimp, this and that and that and this. And come to find out that when you have fibroids, they eat off of, or they get their nourishment off of what you eat.
Really?
And yes, and that's how they grow.
Wow.
That's how they grow, off of what you eat. And my doctor told me that they love oily food. Say they expand by what you put in your body.
Interesting.
And I found that out the hard way. So from my fibroid being small as a seed, it grew, she said, as if I was 5 months pregnant.
Wow.
Now, you couldn't see by my belly whilst my belly was flat still, but she said it was like an alien.
Wow.
It unfortunately attached to my bowels and my bladder. And I always felt that I had to use a bathroom all the time. Even when I emptied my bladder, it felt like I had to go to the bathroom all the time. I started getting very fatigued. I started having heavy menstrual cycles to the point where I had to wear like the largest pads and I had to double them up. When it got really serious, I had to start, unfortunately, wearing Depends because I didn't want to mess up, everything. And I was telling Reed earlier, we were talking, and I said what made me, besides the fatigue, because, I mean, you could have probably looked at me and I probably would have fell back or something. That's how tired and exhausted I always felt because I was anemic, because I was losing way too much blood. So the reason why I decided to really, really take care of it is because my mother was retiring. I would never forget this. My mom was retiring and I didn't want to interrupt anything. So I wanted to make sure I was good. It was my cycle time. I said, you know what, I need to take care of this. I don't want to keep getting up, going to the bathroom, checking. So I decided to go out and buy me a little Depend, right? A pack of Depend. A pack of Depends. I wanted to cover all, I just wanted to be covered. And when I put my dress on, the Depend, I was getting ready to walk out the door. And it sounded like I had a brown paper bag on. And I said, oh no, I can't do this. This is not right. So I had to go get some underwear and put over the Depend to kind of mask the sound.
Right.
So after that Monday, that was on a Saturday, I couldn't wait till Monday came to call my doctor, say, we need to talk. I need to fix this because the Depend, I can't do that. Walking around sounding like, I had that just wasn't going to work for me. So she called me in and she gave me two options, right? The option was to get on the pill, which she said the pill might shrink it, but it's going to eventually probably come back. The other option was to have the laparoscopic surgery. And a person that's never had surgery before, that frightened me. So I did give some consideration to the pill, but I'm like, you know what? I don't want this to come back. I want to be done with this because losing all that blood and just being tired all the time. It was way, and then the Depends to top it off. It was like, you know what? I can't do it. My husband didn't understand really. He was like, babe, we can't do the Depends. And I was like, listen, I'm the one have to go through this, right? But I said, I can't even do it. So we had to take care of it. So I got the operation. And when I tell you ladies, as frightening as it was for me, being a person that's never had surgery before, that was the best decision I've ever made in my life. Now, I had a partial. They didn't take my ovaries because they were still good, right? But she did take the uterus. The ovaries she didn't want to take. They were okay. And she said she didn't want to send me directly through menopause. She said, because once they take your ovaries, you're going to go right into menopause.
Right.
So she didn't think that I was ready to experience that yet, not full-blown menopause. So she said, let it happen naturally.
Yeah.
So, like I said, it was the best decision that I made to have the surgery.
Yeah.
I will tell you, though, when you have the surgery, the bleeding will stop. However, you might still have the symptoms every month as if you still were on your period.
Wow.
That's what I experienced. The moodiness. Yeah, the moodiness. The irritation, being tired.
Yeah.
But I was so glad that I wasn't.
I bet you were.
I wasn't bleeding, and it just made life so much easier.
Wow.
Now the downside of that for me was I gained a lot of weight.
Wow.
So because your hormone, that's dealing with your hormones.
Yeah.
So some people might lose weight drastically, and some people might gain. For me, I gained. Luckily, I was the type of person that worked out, so I probably could have been bigger than what I am right now. But because I had a workout lifestyle, I think that's kind of what saved me. But it's hard when your hormones go through changes.
Yeah.
It's really hard to.
oh my gosh, I know.
Let you take the weight off. I don't care what you do.
I don't care.
It's hard. Even if you try to fast and starve yourself.
It's very hard.
It's hard.
Yeah, lifting weights and stuff and all that stuff. It's very hard.
It's hard.
It's very, very hard. And I know, Tammy, that a lot of women that have it really, really bad, they suffer from depression and anxiety because it's just so hard. And then also, ladies, sometimes as we get older, we don't look the same like we did when we were in our 20s. You know what I mean? We have things happen, we get cellulite and all those little things that happen. But I'm starting to grow to know that I'm who I am now.
Right.
I need to love who I am now.
Right.
Get things to make me still feel sexy that tailor to my body.
Right.
And still keep it pushing.
Yeah.
You know what I mean?
Yeah.
And I know it's easier said than done. You know, I know how it is when you're with the dude and you got the lights off. You don't want them to see everything, see your body and things like that. But you know what's really interesting is if you tell your guy, like, you know, I just don't want you to see you. It's really interesting because they've seen you already.
Ain't that the truth?
They saw you.
And
already.
you know what? We say that and we get like that because I was like that once upon a time. But then I had to look over at my husband, you know, and as funny as this sound, they're not in the best of shape either. So kind of nobody has room to look at each other funny. But us as women, we're more cautious, right?
We are.
Men now, they have a big old belly and whatever, flat-footed or whatever they are, but they're good with that. They come to, you know, tearing up the sheets with their heels. They're okay with that, right? But we can't and that's not that they don't allow us to do that.
Right,
they don't care, but we put so much pressure on ourselves.
We do, and
that we wouldn't dare, you know, do that. But give yourself some grace. Yeah. Right, give yourself some grace to know that, you know what, we are getting older. We're not 23, 24 no more. Right. That's right. And there are some people that our age that still look 23, 24. Oh, yeah. Now, baby, listen, we don't look bad. When we put on our clothes, baby, we step out, okay?
We do now. But, okay. Well, hold on. Now,
I'm just
wait
saying.
a minute.
I'm just saying.
Let me go put some curls in here. Girl, wait a minute. Take these glasses off, honey. Right. Okay, hold on.
We can still get with the girls,
yes,
okay?
We can. Yes,
but
we can.
what we're saying in all seriousness is that give ourselves some grace. We're not 23 and 24 anymore. That's right. So we got to stay in our lane, what I'm trying to say. Yeah. And work your lane.
That's right.
Work your lane.
Work your lane.
Work your lane, girl. When it's time to put it on, put it on.
Put it on.
Okay, let them know that you're not playing.
Well, can I get some?
Hey, I'm sorry.
I'm sorry.
But you know we talk. You know what we're talking about.
Yeah.
But you know, we're going to kind of cut this short. Yeah. We're going to come with another segment with this because this is very important.
It is.
Right? Yeah. We hope that you guys got something out of this. Anything else you want to say, Reed?
Yeah, and if you have any questions about anything, please just comment and please subscribe and share this video. And like I said, we're not doctors. We're just telling you our experience. And again, I'm going to put Dr. Mary Clay Haver's link in the description below and Menopause Barbie's link in the description below. They are very, very good. They have a wealth of knowledge about menopause, and I'm telling you, ladies, you would be blessed just to listen to them. They spend their life now helping us because we deserve it.
Right. And I want to say one more thing. Yeah. Let your spouse or your boyfriends listen to this too. And I want to tell you, men, when we're going through menopause or any type of emotional experience, it's not towards you at all.
That's right.
It's just something that we're going through.
Right.
And be patient with us.
Please.
Just be patient. We love you.
We do.
But it was just something that we have to experience, right? And hopefully you'll be mindful enough and love us enough that you say, you know what? I'm going to hang on in there with you. Yeah. And there's a brighter day coming.
It is.
But we got to go through it.
Yes.
You know?
It is.
Yeah.
But we really thank you all for joining us today.
We do.
And, you know, we look forward to sharing more content with you. And if you have anything on your mind, let us know.
Yes.
You know, we got it for you.
Yes. And we're new at this. So bear with us.
Yes.
But each time you see us, it's going to get better and better. Because we are the best buds. And remember, I am T.
And I am Reed.
And we will see you next time. Have a great night. Best bud.